worked as an occupational therapist for 22 years. My first 2 years I worked with adults, but then I knew I just had an affinity towards the kids, so I quickly made my way into pediatrics. The difference between occupational therapy and physical therapy is occupational therapists typically work with fine motor and sensory processing. Physical therapists work with gross motor skills. So we tend to focus on all of the things that are required to get ready for riding and using your hands in all of the meticulous fine motor ways that are necessary for play, as well as self-care. And we help kids get ready for eating, using utensils, drinking from an open cup. When I first saw him, he was definitely arching, as you were worried about, and moving. He preferred moving in extension, moving on his back versus coming forward as much as we would expect for kids. And then he was tight in his legs and his shoulders. So when we did some stretches to kind of see how he was moving his body and how he felt, he was definitely tight at that point. In general, there's a certain point where it kind of crosses the line into doing it more than what you would expect to see, and Kieran definitely was doing that early on. That was as you were noticing, and it's typically a combination of, I think, things happening with the brain, but high tone is definitely one of the things that contributes to that. So tone is the part, the action on the muscles that come from the brain telling the muscles how much to contract, with what force, for how long, how quickly to contract. And tone is something that we all have, and there's a certain normal range, but then there are people that have a tendency to have lower tone, and then people who have a tendency to have higher tone, and then people outside of the typical range of tone. Any child that is not meeting their developmental milestones within a reasonable range, no two children are the same, but there's kind of a range where we would expect children to meet their developmental milestones. And whenever you have a child that seems to be not meeting those milestones, not rolling when you would expect, not crawling when you would expect, not sitting up when you would expect, then it's definitely helpful to seek services to assess if there's a need for further services. I think that probably erring on the side of caution is always a good thing. So early intervention services are free. You don't need a doctor's referral to access them. Parents can self-refer and call and just ask for a developmental assessment, and then the assessment will help reveal whether or not there is something that needs to be addressed. Early intervention is best sooner rather than later. That's the joy and benefit of early intervention. The child's brain develops tremendously in those first 3 to 5 years of life, so the earlier we can try to help facilitate typical brain development, the better. So the greatest benefit of early intervention is the earlier the better. Early intervention is special because it's one of the few opportunities to address a child holistically. We have the ability to address every aspect of the child, and including their support system and the needs of not only the child but the child's entire support system. So we can work with children in wherever the natural environments that they're at. So if they're at daycare, we can work with daycare providers. We can work in the home. We can work with as many caregivers as are important to that child in order to maximize the benefit to the child. The greatest thing I appreciate about early intervention is its holistic approach.